Yeah, so welcome everyone today. As we say, if you have any questions, pop them in the chat. We'll try and come across to that question as we go throughout. And I will leave my contact details at the end of the session should you need any additional support. We'll also open up time at the end when we stop the recording for you to ask those questions off mic if you need to. Now, to anyone watching this session at a future date, and this goes to the people who will be watching this recording, again, my email will be at the end of the session. You can skip to the end to get that email. If you do want any extra help or ask any questions, please do go ahead. Now, I'm just going to put a link in the chat to begin with. So if everyone can just look in the chat, there is a really useful link. This lays out pretty much everything that I will go through today. Absolutely packed with resources, full of links, and it's from the Department of Health and Social Care. It lays out what good looks like, the framework, but from a very extensive level. So it's basically a support pack for this, and it's where I sourced most of the information. Now, as Nada said, the framework is really important. Now, I've worked in digital transformation, not just in care, but across different industries for many years. It's what most of my career has been based around. And one of the biggest failings that we find when anyone implements any form of digital system or tries to implement any change digitally, have a new digital approach, whatever it might be, is that if they don't have good planning and a good structure for how they're going to use that, how it's going to work, how they're going to implement it, and how they're going to monitor it, we often find it fails. And so a lot of money goes into it, and it's a lot of wasted money when that money could have been put into additional activities that could have supported your organization. That's why this framework will help you. If you have any new digital strategy framework, whatever it is, you've got this framework in place to consider a number of different key points. And that's what we're going to really dive into today, using that resource pack that I've just sent you in the chat. Now, I can send out the slides afterwards, but as I say, everything that you will get from the slides, you will find in that document. One thing I will just say in that document, when you go through it, and I'll just see if I can drag it across onto my screen. The framework applies to local authority and care providers. So when you look at the individual areas, so you've got success measure 1, it will tell you what local authorities should do. And if you scroll down, it has the area for care providers. So we'll be looking at what care providers should do in today's session in terms of implementing that strategy. So back to the presentation, just very quickly, let's just go through an overview of what we will look at today. Nada did mention it briefly there, but we'll define what good digital working is. We will look at what that framework is, how it's structured, and we'll go through that framework, covering off certain areas such as digital leadership, and we'll really dive into what that means. And we'll look at those different attributes within that framework, and there are 7 different attributes in there. And then looking at reflective improvements, so how you can implement reflection into your digital strategy. Again, really important that you're identifying strengths, areas of improvement, so that it isn't just something that you bring in, hope it works, and then it fails. So sometimes we have physical tech that comes in. We've often found that when there is no plan in place, it will literally sit in a cupboard collecting dust, and a huge wasted investment there. And then finally, just briefly, we'll cover off what will be going into the next session, that CQC assessment. We'll touch briefly on that, sort of what CQC are looking for, but we won't do a real deep dive today. That's for future learning. So just understanding what good looks like. Now, again, what good looks like is the framework. It's basically a suite of guidance on digital working, as I said a moment ago, across health and social care. And obviously, when you go into the resource packs, divide between local authority and care providers. And it was developed by NHS England and the Department of Health and Social Care. And that document I have just posted is from the Department of Health and Social Care. As I said, you won't need this slide deck unless you want to run a presentation from us. And in that case, we can provide this to you. But if you need all the information, it is contained within that link there. So the framework, what is it? Broken down into 7 key areas, and each of those areas provides guidance on what you should be looking to do as a care provider when you're implementing digital strategy or digital technology, whatever it might be. The first one being well led. So obviously you need to lead on that digital initiative, and leadership need to understand their role in that. why their role is so important when you're bringing in digital working. Ensuring smart foundations as well. So we might have the tech, but if we don't have a foundation for that tech to sit on, again, it's probably going to fail. And I'll give some case studies on that in a moment. Safe practice. So how can we use it safely? So looking at that cyber security aspect and tools that are available to us to support us on that. Workforce support and empowering people, two very closely linked there, interrelated. How can we support our workforce? I'm a huge believer in upskilling people and focusing on people in an organization. I believe if people have confidence to use a system or use a new technology, they're going to adopt it much better than people who don't have the confidence. And that's why I really believe in empowering people in our organization, giving them the confidence to really see the vision and understand how to use this tech and how it can benefit them, the organization, and those within their care. And as I said, within care, improving care, that is our overall objective here. Why would we bring in a new strategy or system if it wasn't going to improve care? We are the care sector. That is what we are looking to do. And if we're bringing in these technologies, what are our role as a care provider in implementing digital systems of digital working in improving care? And then finally, healthy populations. And we'll touch on exactly what that means from looking at the wider community when implementing tech and how we can support those in the wider community too and link with certain partners. So again, if you just go onto that support pack, they just give an infographic here, which just lays out how each of these 7 principles are interconnected. They show them from a digitization standpoint, a transformation standpoint, and a connecting standpoint. So obviously supporting workforce is the connection part, and it brings all those pieces together. And at the center, empowering people. As I mentioned before, we need to empower those around us in our organization. If we're not doing that, people will not see the vision. They will not feel confident. And again, it would just be useless and a waste in investment. So we need to put that at the center of everything we do. And as I say, I'm a huge believer and driver of that. And that digitalization, if we're bringing that tech, has to be well led. I probably have some leaders or organizations in here, and it's essential that you understand your role here. How are you going to implement this? Ensure there is a foundation and a good foundation to hit the ground running, and also that it's safe. Huge component of this is data security, data protection. We need to ensure that when we're using these systems, we're keeping the data safe. We're also keeping our organization safe from malicious parties like cyber criminals. All of that needs to be considered. So we'll touch on that as we go through. And then finally, transformation. What are we actually trying to achieve? Well, we want to improve care. And we want to ensure that, obviously, that's healthy population side of things, as a wide community, it has an impact. So this is how all of these interrelate. But as I say, putting people at the center and then leading on that well. So let's just start off with well-led. It's the first principle, and that is digital leadership. So what does that mean? If we go into that support pack, there's a brief quote on there as to what this means. And it's basically your organization's leaders, they fully understand the benefits of digital technology. So before we start anything, we have to understand why we're using that tech. We have to understand the benefit of it, because if we don't understand the benefit of it, how are we going to relay that information? How are we going to inspire our workforce to really implement it? If we aren't inspired by it, if we don't believe in it, and it just comes in, well, no one else is going to see the vision. There'll be no confidence, and it will just fall to the side. So we also want to have the confidence and capability to drive forward that digital transformation. So yeah, we have the technology. What are we trying to achieve with it? Well, we're trying to achieve transformation. We want to improve care. How are we going to do that? How are we going to drive that? Do we have the confidence to use that tech to achieve that? And then sharing and learning from best practice. So again, key point here, bringing it all together, is looking at monitoring how we're using that technology. Again, whatever it might be, we need to understand if it's working, and if it's not, we need to improve. Because again, it's a wasted investment. So breaking this down even further, I've just put some key points in here around digital leadership and what, as a care provider, you are expected to do. So first, point on all of this as a leader is you need to have a clear vision and obviously a credible strategy for how to use that digital technology. And again, if we look at that infographic before, we need to understand and have a strategy for how we're going to transform our organization using that tech. What is the point in having that tech? And this is for you to plan, have that vision, lay that vision out, so you've got a good starting point to then relay that to members of staff. It's really good as well to have the knowledge and skills to deliver digital transformation and build digital confidence in your team. This is a difficult one. Building digital confidence. And this often requires a level of soft skills and empathy from ourselves. So a level of understanding people and how to interact and communicate with people. Now, I used to run national strategies all around soft skills and empathy. And we eventually ended up, to begin with, we used to run strategy where we would just teach people digital skills. And it became very evident that the one skill people were lacking was communication. Yeah, people could be absolutely brilliant. They could understand the tech. They could be technical geniuses. But then when it came to communicating to their staff or their colleagues, they just weren't able to do it. And people would either switch off, grow bored, get overwhelmed. We often had a lot of these technical geniuses come in and they would just use so much jargon and technical language that people would literally just... they weren't interested. This is overwhelming. I'm not even going to try and use this. And that all came down from a communication piece. So it's about understanding how different people work, how they operate, how they learn, and having the patience and empathy, putting ourselves in their shoes to understand where they may be coming from, asking questions from them, active listening. And again, if they're not gauging it, don't lose your patience, don't intimidate them, don't punish them. We've got to support them on that journey. And we found that doing that, and again, putting people at the heart, understanding them, really being able to communicate, you don't need to be that digitally savvy if you're a really good communicator. And what we actually started to do was we replaced the staff. So we were doing these communication what are they called, programs, where we had a number of staff in place, and a lot of it were made up of these really savvy technical people. And eventually we ended up, as I said, replacing most of them with people who are good communicators. So they weren't necessarily the best when it came to technology, but they were really good at empathizing and understanding how to communicate. And again, we had way more success, much more measurable success, and better adoption for digital strategy. And that goes with embedment. Those two tie together. We need to ensure that we are able to actually embed that. And embedment means it's getting used and it's being used effectively and efficiently. So also as a leader, we need to be accurate and timely with data. So all our data needs to be accurate and up to date. Now that's important. If you look at GDPR, when it comes to holding data, one of our legal requirements, and that is a legal requirement as an organization, is we need to keep data accurate and we need to keep it up to date. If we get an inspection from CQC, they come along, one thing they will look at is they will look to see if our data is accurate and up to date. And if it isn't, that could lead to implications and repercussions. So again, we need to make sure that is kept up to date, it's audited, it's monitored, and we need to ensure that data sharing is done in line with those data protection laws. Now, I've done several sessions in the past. You can find them on our website. I've also done sessions on behalf of the Digital Care Hub, and you can find these on their website as well, all around GDPR, data protection, what that means, how to keep data safe, and why you need to keep data safe. All I'll say here on this is it is a legal requirement. And one of the misunderstandings around personal data is that personal data isn't just name, date of birth. It also includes indirect personal data. So it's anything, any piece of information that can identify someone, whether it be direct, name, date of birth, or indirect. And indirect can become very obscure. So the same goes for when we're using digital systems, how we keeping that data safe. That is our legal obligation to do that. Now, it's also important that we're informing people on how and why their information is used and the choices they have. Now, one thing I will mention here, and there's a bit of a grey area and a subject of confusion, is that yes, you will be using systems, they will be containing people's data. And it's important that if someone asks, you're able to demonstrate why you're using that. Now, in a lot of these situations, it's often down to something called compliant consent. So what it means is that we assume we have the consent. We do make people aware, but they're allowed to object. And if they object, it is our obligation to inform that person that as to why we are using their data on these systems and how it's going to benefit their care. Now, that's really important to distinguish here. If somebody does object, and they are completely within their right to object, and they can have their data removed from their systems, but it is our obligation as a care provider to demonstrate to them why we're using it and why it will better their care. That falls in line with, again, having that clear digital vision. If you understand why you're bringing that tech in, you will understand how it's going to benefit those in your care. If you have the knowledge and skills on that, you will be able to demonstrate how it's going to better someone's care. And you need to be able to relay that to someone if they object to it. And they also need to understand the choices they have. Within the UK, they do, under GDPR, have the right to withhold their data from use, but it's our obligation, as I say, as a care provider, to tell them of the risk to that and obviously the benefit of that system. And then finally, a supportive culture. So I mentioned that before, that soft skills and empathy piece. We need to have that culture that encourages safe digital practices. So one, if we're using digital systems, we need to keep that data safe. And also we need to have open communication to support our staff. If we are open, if we're empathetic, they will have confidence, and also they will understand if there's an issue, they will know how to resolve it. So that is your obligation as a leader. Now, again, we can have the best technology, we can understand the vision, but if we don't have a good foundation in place, again, it's not going to work. It's going to be quite useless. And what they mean by smart foundations here is that your organization has modern and secure digital infrastructure, and staff have reliable access to comprehensive and up-to-date digital records. Now, I will touch on a point here. So, first one, as a care provider, you need to have reliable internet connection. Obviously, if you're using a digital system, it's probably going to be connected to the internet. And to get effective use out of that, you need good internet. Now, I have spoken to a number of care providers around this, and I'll give you one example. So about a year ago, and this isn't uncommon. When I talk to care providers, we often find this is the case. I had a care provider who decided to put a lot of money into implementing basically Alexas into their organization. They spent quite a lot of money. They basically got a device for every single resident in the organization. They also had to integrate new systems to ensure this worked, and they put boosters in place, which they bought from their internet provider. And they did end up racking up quite a lot of money, subscriptions, all of this, all on this tech. Didn't work at all. And actually, it got worse. They originally had one Alexa device for one resident, and it worked fine. But now they had, I think it was over 30 Alexas. That one didn't work anymore. None of them worked. And it caused huge distress to that resident who was using that device before, because it did add quality to life to them. It did help with their day-to-day. Now, what had happened is research hadn't been done, and they were operating off an incredibly low internet speed. They weren't aware of this. They were basically sold their internet by a door-to-door salesman. They were charged an extortionate fee, and year on year, a percentage increase was applied to that. It was one of the highest cost internet services I've heard, and surprisingly, the speed of that internet, as I said, was astronomically low. And so what happened was, yeah, it was able to support one device, but now when they were trying to support 30, completely overwhelmed the system. The latency, the ping, as it's known, was way too high, and nothing worked. And so, yeah, they did all this investment, but they failed to look at that one piece, which was reliable internet connection. Now, there is a way that you can check this, really simple. You can just do simple speed checkers online. Can just go to Google, type in speed check. I'll just show you what this looks like. I've just typed in speed checker here. I will be doing sessions in the future as well, all around problem solving, looking at internet speeds and that. So I won't touch on this for too long today. Choose any of these. We'll just go with any of them. So we'll just click on one. And what will happen now is you can just quickly start a test on your internet. My one is slower than what you would expect, and that's because I live in a very rural area, although it is a lot faster than what I would expect. Now, that works just for me because I'm the only one right now using a computer on the internet. But if you are a big care provider using lots of devices, this is something that you really need to look at and consider in here. And there's three metrics on here that you're looking at. You're looking at download speed. I would say as an organization, you would want this at least in the triple figures. Now, this person had this in the single figures for a care home operating. When we totaled all the devices in that home that were relying off the internet, we were looking at well over 60 devices. And they had less than 10% of what I have using just one device where I am in the countryside. You're also looking at upload speed. Upload speed will also always be significantly lower. But again, as a care provider, you do definitely want this into the double figures. And then finally, you have something called response time. And response time is how quickly your web page is going to open, how quickly, when things start lagging and it's slow moving between pages and there's buffering involved. That often happens when a system's overwhelmed. So if we've got lots of devices going onto a system at once, this becomes really high. And this is basically done in milliseconds. So it's how quick responsive your system is. If this figure is really high, I'm talking quadruple figures, things are going to be very slow. Now, mine is really good, 33 milliseconds, perfect. That's great. It means things are going to jump around pretty quickly for me. But that's just a quick health check that you can run on your internet, see what you're looking at. And then you can just look at providers, what they offer in your area, have conversations. If you are in a remote location, just a very useful tip here is to maybe explore satellite internet. Yes, there are issues with satellite in that you will have satellite dish. You need to make sure it has a clear vision of the sky. And sometimes if there is very cloudy, stormy weather, you can have a bit slower internet. But in general, you're going to have much faster internet than, say, you have a really old connection line. And the same, this all ties into the digital switchover that's coming soon. And I'll touch on that in a moment. And that's actually point 8. The second part here is to equip staff. So as an organization, your staff probably have devices. They probably have digital means within that organization. You need to make sure that their devices are also good. They're updated. You are doing regular updates. You're doing software updates, that they're able to connect to the internet, that they're running effectively. It's not outdated technology. And there's a really good tool you can use to monitor all of this. And it's called the DSPT. Some of you may have done that. I'll touch on that as we go through today a bit later on, but it's a free tool and it just ensures that you have put everything in place. One, around data protection, but also having systems and policy in place to ensure you're monitoring things, as I just mentioned there. Again, we're looking at that confidence piece. A lot of these will follow on that confidence. It's just making sure that you have the confidence and skills and knowledge to identify, recommend, and use appropriate digital technology. So again, you know what you're talking about. You know what you're using. Follow secure email policies. So really important. And I'm doing a big push at the moment around secure email. As a care provider, you should be using secure email. Now, it is your obligation. If you are, say, for instance, if you heard that, that's my doorbell. It's a very loud bell, so it might have background noise suppressed, but it often makes me jump. But as I say, if you are using, I'm doing a big push at the moment, secure email. If you are sending sensitive data, a GDPR requirement there is that you're sending that securely. And so that needs to be done on secure email. Now, there is a standard in place. You can Google that. I would say the easiest measure available to a care provider is NHS MAP. It's already set up, it's already monitored. If you have an ODS code, if you've started the DSPT, so complete it to approaching standards or standards met, you can have NHS MAP. And it does not take a long time to set up, and it's a secure email standard. Regardless of whether you're with the NHS or not, you're able to have that. And I can definitely support you with that. I've enrolled hundreds of care homes and care providers onto NHS Mail, and I can definitely support you. Just drop me an email at the end. So that's really important that you are implementing that on there. Especially if you are communicating with NHS partners. Again, part of the secure email standards, if you are doing communication with NHS or you're using any NHS systems, you have to have you have to have the secure email standard. So again, you can do a search on that. I do lots of sessions on secure email, whether it be with the Digital Care Hub, whether it be with Sussex InReach, but I also do that for Oxford Association of Care Providers as well. So there are different areas that I cover, where I run these webinars, and you can definitely look out for any of those future sessions on Secure Email. Also, make use of resources that are available to you. So there are loads of resources out there. Again, a lot of these and these points that I go through on here are all contained within that pack. If you go actually to Smart Foundations and look on this point, they will have links to these resources. And if you go down to the bottom of that pack, they have an entire resources page, which goes through things like the assured supplier list, so that you are able to find suppliers that are, one, accredited, and you have that level of trust. It is important that if you're using digital tech or implementing it, that you have that your supplier who's supplying that is also complying with industry standard. Because if they're not, or they have weak systems, or they are, let's just say, open to a cybersecurity attack, that becomes a weak link in our supply chain, and that could impact our organization significantly. So we can check that, build those good relationships with your suppliers. Use secure cloud storage. So again, really important. A lot of providers use cloud storage. Is it secure? You can find that out by communicating with your supplier. Do they have things in place like encryption? Do they have end-to-end encryption? Do they have passive encryption? So passive encryption is when it just sits on the system. Is it encrypted and safe? And end-to-end encryption is when or you can describe it as a moving encryption. If that's moving onto our cloud storage, is it protected on the journey it makes from our computer to cloud? So really important that it's secure, it's safe from cyber attack. Because we're using cloud storage to protect data, it needs to be safe. We need to have appropriate archiving and retention of records. Again, all of this you can find within that DSPT, the Data Security Protection Toolkit, which is a free tool. And I'll go through in great detail how you can get appropriate archiving, what you're looking at in terms of retention, what CQC are probably looking at if they were to do an inspection, on how long you're holding records. Again, it's all laid out in there. It's free, really useful. I don't know why you wouldn't do it. And we can help you with that. And again, the final point here is that you're planning and preparing for changes required in residential settings ahead of the digital switchover. Now, some of you may have heard of this, some of you may not. There is something called a digital switchover coming. And again, I've done sessions on this in great detail, where they're basically switching off the old telephone lines. So, in the past, everything was done over telephone lines, and that was where the internet originally started. We used to have dial-up connections. Some people still have that very old internet, low internet speeds. It was done through the wires, and you'd hear that horrible dial-up tone. That is still the case. A lot of phone lines, a lot of CCTV, a lot of alarm systems are still done on the old phone lines, and it might be the case for your organization. Now, that is all getting switched off, and that is coming. They have pushed the date back a few times, so you do still have a little bit of time, but it's a good idea to start looking at that now. Now, the government have said to your internet service providers that they need to communicate with you. And the people they need to prioritize are those who are vulnerable or caring for others. So as a care organization, that'll be yourselves. But if they haven't done that, you can open up a conversation. Easiest way to do this, call your internet service provider and just say to them, look, I've heard there's a digital switchover coming. Does this impact me? And then if it does, they can review what you need to put in place, whether it be new internet, and they will. Again, the government have told them they have to provide you with an alternative. And also, they will look in detail at your organization and if it will impact you and what you can do to prevent that. And they'll work with you. They need to do that. So easiest thing to do, just phone your internet service provider. And that's something that all care providers need to do. Now, a lot of you won't notice anything. It'll just automatically happen. And your internet service provider, if they've done their job right, would already move everything over for you. But it comes down to, as I say, if we've got systems that do rely off the old telephone lines, and it can be alarm systems, CCTV, those kind of things, even your internet or phone lines. So do note that we are doing an initiative on the digital switchover, and we are working in partnership with an organization on the digital switchover. So if that's something that you do need help with, or you do need someone to audit your organization and support you with that, and it could even be that they lay a good foundation for you. We do have a partner in place who can come, do a review, see if you can improve your internet, see if you can improve your internet speed, and then what you can do to just improve the overall infrastructure of your company. But drop me an email if you want some more information at the end of this session. So the next point on here is safe practice. Now, we're using a new system, we're using new tech, it needs to be safe. Now, something that you will always do and you need to do whenever you bring in a new strategy or a new product or a new project is you will be running risk assessments on that. Again, that is part of the law, that is a legal requirement. Anything new, any new strategy that comes in, you need to run a data protection impact assessment, and that will just monitor how you're keeping data safe and running and identifying risk and identifying how you would mitigate that risk. Now, if you haven't done that, again, CQC they would look for that, so you do need to have that in place. But the same goes for any new technology that we bring in. It's also a really good idea that we have cybersecurity in place. And that just means that organizations will be able to safely use, share information, which can improve care and support people. So that's what we're looking at here. That we've got safe practice, we're running those data protection impact assessments, that we have good cybersecurity, and that we have those good relationships with our suppliers. Now, what do you need to do as a care provider? So again, there are legal requirements there, and I have mentioned one a moment ago, but we need to meet those legal requirements around data protection. That is our legal requirement. As I say, I've done sessions in the past all around data protection, and we can supply you with that information should you need it. We can also review with you or work with you as an organization on that. But it's important that you have appropriate cybersecurity and information governance functions in place, including data protection leads or officers if your organization complies with that. Now, again, you can get all of this information on the DSPT, that free tool. It takes a few minutes to register for it if you've got an ODS code, and you can work through that, complete it, and it just, all those questions will give you the resources and information to take you through to ensure that you have everything in place to comply with these requirements. It's also important that you understand, follow, improve your data protection cybersecurity arrangements, including staff training. So again, one of the requirements is that our staff are trained with anything. And as we mentioned in those other 2 points, staff training is essential. We have to make sure that our staff understand and they have confidence to use any new system that we have. Another thing that you must have in place are business continuity plans. A huge area people fall short on is resilience against all scenarios, whether it be cyber attacks, whether it be systems going down, whether it be fires, floods, whatever it might be that impacts our data or our systems or operationally. Do you have a plan in place that will mean that you can continue business as usual should you face one of multiple scenarios? And that in itself will ensure that you know exactly what to do and you're prepared. Again, there is statistics and research out there that shows that people save significant amounts of money when impacted if they have a business continuity plan in place, and it has much less detriment to the organization. And then finally, make use of assured supplier lists. Again, I mentioned that a moment ago, to ensure your DSCR solutions have the appropriate safety and security systems and procedures are maintained and enforced in accordance with industry practice. Again, if we're using these systems, we need to make sure they're assured. We need to make sure that they are compliant, and we need to make sure they are safe. So with anything that we use, safety is absolutely key. There are more points on here, and again, I've mentioned this over and over and over again, and you'll probably get sick of hearing this by the end of this session, but the DSPT, one of the requirements as a care provider of what good looks like is actually to complete the DSPT. Now, once you've published the DSPT, you can't just publish it and then be done with it forever. You will get a certification at the end, but you do need to publish that annually. So the only way to keep that up to date is to publish it annually. And it might just mean going through, not much might change. You just replicate your answers each year and submit it again. A few things might change. You go in, there might be a new question added. Again, just monitoring that, but each year you do need to submit that. And that's to a minimum level of standards met. Now, we are funded to run the DSPT program, and we can offer that support for free. It is a free service and the tool is free. So it won't cost anything to your organization, just a small amount of your time. But that time spent is a huge investment into ensuring that you have full compliance. And again, I will leave my email at the end. Drop me an email. I can get you an into one-to-one and support you with that. Now, and then finally, make use of that free support. You'll hear a lot of this, make use of free support out there. There is loads of free support. There's loads of guidance. You've got the Better Security, Better Care program. You've got Digital Care Hub, loads on there. If you go into that resource pack, you'll find links to all of that and all that free support. Now, the next two, they are interrelated. They're linked together. I've put them together. There's a few points, but it's supporting your workforce. And as I say, if you look at that infographic at the start, this sits at the center of all of this. We can have the greatest plans, the greatest tech. We can understand it inside out. But if we don't support our workforce and empower them, it will be useless. That also goes to protecting our organization, because if our staff don't understand how to protect or use technology safely, that is a huge risk. Now, what I mean by that is if you look at cybersecurity stats and if you look at the most recent cyber security surveys released by the government, the number one causation that leads to security incidents or cybersecurity attacks that are successful is human error. 99% of cases. That is us giving cyber criminals or information, or mishandling our systems, or not understanding how to use their systems certain ways. So just that alone is the number one reason that we need to empower our staff and support our workforce through all of this. So what does this mean? Supporting your workforce means developing a skilled, capable workforce who can confidently identify, recommend, and use appropriate technology safely and effectively for people drawing on social care. And what are the expectations of a organization? There's quite a few here because I've tied the two together. But firstly, just to ensure that staff understand and have required skills and confidence to use those systems, that technology in their role. Now, again, you might be a technical genius, but it comes down to communication. Have empathy, listen to the people, active listen. Don't come on too hard. Don't overwhelm them. Don't use too much jargon. You'll probably get someone nodding, not saying, yeah, I understand. But 3 months down the line, they're not using it, or they're not using it effectively. And that's because they didn't have the confidence. They didn't have the confidence to look, in their mind, stupid when they're not. They just don't understand how to use the tech because they were overwhelmed. Build a positive learning environment. Those two link together, and develop a plan for digital skills training. Again, really important. Digital skills training covers a huge area. There's just some of these here, like information governance, how to keep that information safe and secure, what are our responsibilities, information sharing, and cyber security. Use appropriate solutions to support all staff to build their skills and digital confidence. Again, digital confidence, key piece here. If people are confident, they're going to ask the right questions, they're going to understand how to use it, and they're going to actively want to use it and see that vision. Ensure digital skills are included in induction appraisal processes. So again, part of the DSPT is it requires you to add into your induction. So when somebody joins the organization, that they understand data protection, cybersecurity. There's a whole digital element in there. And so training our staff on a regular basis, again, will ensure that they are an efficient workforce, they're a productive workforce, and they're a safe workforce. And that includes agency staff. Again, if we've got agency staff coming in, the same applies to them. They too have access to our data, our systems, and they are responsible for the reputation of our organization. So again, this is all staff across the board, and it even goes for our stakeholders, so even suppliers, monitoring what they're doing and having those good relationships with suppliers. Create opportunities for peer-to-peer digital learning. This may include developing some staff as digital champions. Now, again, digital champion, all that means is you basically have a person in your organization who is the go-to for learning. That is the person who's amazing at communicating. They don't have to be a digital wizard, but they know where to get information from. So someone could approach that person and say, hey, How do I do this? And that person may say, look, I'll be honest with you, I don't know the answer right now, but I can go and find out the answer. And that person will go find the answer. Because they're a great communicator, they will be able to relay that information effectively. So it could be you might be a leader of an organization and you already are thinking of somebody in your organization who's brilliant at communication. Use that person as a digital champion. You'll probably notice that you're able to embed tech and systems and solutions much more effectively if you streamline it through that person. And I just think this is really key, and we've seen great success there. That's what I was mentioning at the start of the session on those programs that we've run. And then finally, work together with those in the local community. So local authority, the ICS, membership organizations, other partners, learn, promote digital learning opportunities. So it just connects you to that wider community. You learn about opportunities, you learn about new systems, new tech, you learn about improvements. You could live under a rock and just shut yourself off from everything, but I'm pretty sure, and I could put my money on it, you'll fall well behind in terms of digital strategy because the technology industry is moving so fast. So it's a good idea to just keep connected, keep learning, keep that information on the wider society out there. Now, there are a few more points here before I move on. So important that you're co-producing and personalizing care plans with people actively involving family, friends, carers to support person-centered care. Again, this is all about empowerment. These should be so obvious to you as an organization. We need to get that feedback. We need to learn from those connected to our organization to shape these plans. Empower people, use support to use digital technologies. Again, it's all about empowerment, confidence, using tech. Ensure people have the option to access and jointly manage their DSCR information, allowing them to take their own record throughout their care journey. Encourage appropriate access for families, friends, carers, any key stakeholder related to our organization, and use digital technology to support people to stay connected to family, friends, and their community. So again, you can use that tech, connect people, connect them outside of their organization. I've had instances, again, that I mentioned before, where people were using tech to communicate, do Skype calls, do Teams calls with family, Zoom calls with family, where they weren't able to before, and it dramatically improved their quality of life. And it is our responsibility to identify using tech to be inclusive for those in our care. Again, I think that's a responsibility. If you know of a technology, or if you just do a tiny bit of research, you're able to find a bit of technology that you know will dramatically improve someone's quality of life, bring it in. And that links to improvement of care, as I've just gone on about over and over and over again. So this is just effective use of digital technology, data, processes to support the delivery of outstanding quality of personalized care and support at the right place, the right time. This is what it all comes down to at the end of the day. Why would we do any of this if it wasn't to improve care? And again, we've identified a few key pieces of information here that you need to do as a care provider. And these go down to, again, promoting learning. You'll see that same theme carried out amongst all of these. It's a lot of the same thing carried across, but promoting a learning culture to identify how and where digital technology can be incorporated into your care and support offer to improve people's outcomes. That learning culture can be learning from those connected to our organization, the wider society, as we mentioned before. So local authority, different groups we might be partnered with. It could be our staff, empowering them to be able to speak up and give their ideas and encouraging that. And then testing and trialing, building a vision, going back to the very start of what good looks like, and then leading on it, building a good foundation, proving care. Work with local authorities, as I said before, to use care technology to maintain people's mobility, independence, pursue their hobbies, interests. I mentioned this before. Identify tech that can improve someone's care. Local authorities probably have a lot of information on this. They've probably done some research, work with them, see what tech there is available, see what grants there might be available to you to implement this to improve people's lives. Tech go a really long way in helping people feel less isolated and more connected. Work in partnership with your ICS to understand the funding opportunity options. So again, there is funding out there for different technologies to implement. Look for it. You'd be surprised at how many care providers we've tried to work with. We've literally had funding available for them to implement tech, and they just weren't interested. They would literally be being given money to bring technology in. But because it seemed overwhelming, they didn't understand it, and they had the pressures of their industry. Again, it just fell to the side. Actively use your DSCRs to inform service improvements and support the delivery of high quality personalized care. Share learning and evidence which demonstrates the impact of a new digital solution. So again, you may be saying how great something is, but do you have evidence to back that up? It's a good idea to find that. Use case studies. And then use available data to support quality monitoring, learning, and improvement. Again, really important. If we're bringing in technology, we need to ensure that we're continually improving it and improving that learning. And then finally, healthy populations. What does that mean? This is point 7 on that, what good looks like. And healthy populations is having good data to understand and plan for the needs of the population, whether at a community level or individual level. So that means that we can reduce inequalities and improve outcomes for all people. So we can be that leader in that environment. And there are, again, a list of requirements here that I will quickly go through. I am conscious of time today, can source all this information online, but it's just using that guidance. And there's loads of guidance in that pack that I put at the start of the session to decide upon the correct and lawful way to use data. Really important that we are keeping data safe. That will protect everyone related to our organization. Use data management and data analysis to monitor the health and well-being of people you support. Use data to detect potential issues to enable more responsive care and maintain health and well-being to improve outcomes for people you support. Use data to improve the well-being of people you support to ensure that they can live the life they choose, including people at later stages of life. So again, all these link together. You will have data available to you. Analyze that data. Look for trends. Look for how you can improve by using that data. Data is so crucial and essential to us, and we can find information in that data to shape our strategy. Use data management analytics to support the training and needs of your workforce. So again, you can use data analysis to look at how your workforce are operating. Identify needs, again, looking at different trends, and then focusing in on those needs. Use data analytics to identify areas of service improvement, support service quality and safety, and access your service against regulatory requirements. And then finally, work with partners in your local health and care system. And I say, I'm conscious of time today, so I will just quickly move through. And this takes us on. So those are the 7 key points. Now, again, really important that when you are implementing any new strategy or digital working, that as you go on that journey, and it is a journey, you're looking at the strong points of it, you're honing in on those, and you're looking for improvements. Now, if you're not looking for these, you're not going to effectively implement it. Really important. So how do we do this? So just some really simple tips here that you can use is structured self-assessments. So assess the technology, identify strengths and improvements in social care, talk to your staff, how are they finding it, open dialogue, communication, recognize those strengths. So effective digital records and compliance processes should be celebrated and shared to build organizational confidence. So promote those strengths. It doesn't all have to be doom and gloom. Oh, this isn't working, that's not working, it's terrible. I've had situations where new tech has been implemented into an organization, and this isn't necessarily in care. I'll give you one example. We implemented a new system into a major multinational organization. So we had probably, I would say, 30,000 people using this system. And the feedback that was coming through was a huge amount of negative. But when we looked at the data, it didn't correlate with what we were hearing. It was actually improving operation. And the reason for that is, again, people don't like change. And that's something we need to recognize. Change is uncomfortable. If you go to a new system, there's going to be this period of teething where people won't like it. And that's where we need to come in and shape it and improve it and, well, show them the vision, show them the positives, show them the strengths. And the reality was this system was working really well, much better than the previous system, because business was going through the roof, communication with customers was going through the roof. But we're just hearing loads of negative feedback. The negative feedback was down to people not understanding where to click on certain areas. It was the small intricacies, but so often negatives can be, and there's research and there's psychological research, a negative point can have 10 times more strength than a positive. Now we need to try and flip that and really show the strength to our systems to build confidence in our workforce. Address areas of improvement. Yes, there might be weaknesses, so we need to address those. I'm not saying just forget about them, silence them, improve them, fix them. This could be staff skills gaps. A lot of those intricacies I mentioned before were just skills gap in staff. It was where the training wasn't as effective as it could have been. There were certain areas within that organization where they were literally just telling people they want to use it and get on with it, and they weren't really providing the training there. So that's what we're going to try and look at. And also technical barriers. If we don't have those strong foundations in place, that could tie into this. And it could be that in the case I mentioned before, with all the Alexa devices, the weakness and the improvement they could have made was just getting better internet. And then action planning and tracking. So look at a plan. You can break this down into a number of ways. So maybe you have a goal, so 30, 60, 90-day goal set on how you're looking to implement this and the successes you're meant to have, and then actively track that and continuously improve. And then finally, the final point I want to touch on, and I won't go too much into detail in this because we will go into great more detail this in future sessions, is CQC. Now, what are they looking at? So I've just put a few quotes on here, exactly what CQC will be looking for. So they are saying we expect providers to demonstrate compliance with data security and protection toolkits, the DSPT. They are now expecting this. They are looking at this, especially with digitization in social care. If you haven't done the DSPT and you don't know what it is, send me an email. We are funded for that, and we offer free support on DSPT. So we'll be able to go through that with you. They're looking for that to be completed annually, but it basically just shows that you are complying with data security, data protection. You know how to use systems. You know how to keep them safe. You're able to demonstrate that with this toolkit. They're also saying we do not access the standard of technical functioning. They're not looking at your system and saying, oh, does that system work well? That's not what they're looking at. What they're looking at is they're looking at whether your records are up to date, it's safe, the data is being used appropriately and correctly. So these are the kind of things that CQC are checking. And they will say we routinely look at providers' records as part of our inspection, actively focusing on the information in the records, how that information is being used. So how are you using it? How are you processing that information? And the security measures to store and share that information. So really important that we are complying with those steps. That is what CQC is looking at. They're not coming in saying, wow, that's a really nice shiny system and that works really well. They're looking deeper than that at the data, how it's being protected, how you are improving people's care with that system. So again, that's part of that vision, that leadership. And that's why we can use that framework that we've gone through today, what good looks like, and focusing in on all those key points, we will be able to demonstrate that very clearly and effectively to CQC. So the final piece here, just some next steps on here. Really important, if you have a new digital system, you do maintain that momentum. That, yeah, brilliant. Wow, we got this new vision, we got this training, but within a week it all drops off and we're focusing on the next thing. It's not going to help. Embedment is key. Embedding change is key. And that's why we need to do those check-ins, assign ownership, identify support needs, communicate with our staff, and monitor improvement. So that is the end of the session. A lot of information today to go through. As I said, I did put that information pack at the start of the session. I'll just put it back in the chat again now. So that is in there right now. So you can access that. Very quickly, before I open up for questions, we will stop recording